of past 6 years, and you'll see that I have fought very hard to protect programs here in Alameda County.
Thank you. I neglected to say at the beginning of this, if any of you would like the question repeated, just ask. I'll be happy to do it. Mr. Valle?
And the question was on balancing the budget.
Yes. How do you evaluate where to make cuts if the budget demands them? What areas would you not cut under any circumstances? And is there a way possible to get a fairer amount of funds to the south part of the county?
You know, just today we had our Social Services Subcommittee meeting. President Miley and myself sit on that committee. And one of the presentations that was given to us was the status of veterans in Alameda County. We have 17,000 veterans that have been under the county and the services that we provide for them. Yet we only have 3 counselors providing services to 17,000 veterans. And we're expecting an influx of several more veterans as a result of the downsizing of the war in Afghanistan. To me, that's unacceptable. We also have made other cuts in other departments. However, those cuts, in dialogue with the deputy sheriffs, the probation department, with social services, and other departments, public works, those cuts were done in collaboration with the bargaining units. And the bargaining units in Alameda County stepped up and sacrificed their pensions, their health benefits, and several of their own pay increases to balance the county budget. And that's how this last budget has been balanced. So through dialogue and interaction with our own staffs, it's really critical that everybody give and take, but each of us understand our respective roles in keeping the vital services, such as veteran services and child protective services, as a priority.
Thank you. Mr. Green?
First of all, I would say that just based on my own experience, again, in Union City for nearly 2 decades as the mayor, that frankly, we haven't had anything that has been entirely off limits in terms of cuts when it comes time to make cuts. There are no sacred areas. They all get hit at some point. However, inside that paradigm, there are going to be some areas which do get hit harder than others. So I think you always have to end up making the call there of prioritization in terms of what are the most important services that a community cannot go without. And it's certainly at the city level, and I think you probably took most of the unincorporated part of the county and asked citizens in that area also. You know, the last area you would want to be cutting would be public safety. I think that would resonate throughout every city in our county. I think it would resonate throughout all of the unincorporated area as well, which isn't to say that if he had to cut in public safety, yes, you can cut in public safety. I would say that would probably be the last place to go to. We always talk about areas in southern Alameda County not getting as much perhaps as Oakland or Berkeley or Alameda, pick your favorite city in the north. And that has to be balanced, I think, always with the aspect of need. Now, in some areas of the county, certain areas are going to have a greater need than in others. For transportation, it might be argued actually that the southern and eastern parts of the county are in greater need right now than in the north. In terms of social services, that might be inverted, although which isn't to say we don't have needs here, but I think, again, you're going to have to be able to collaboratively and cooperatively work with your associates there on balancing needs as they arise throughout Alameda County.
Thank you. Mr. Turnquist?
First of all, there'd be absolutely 0 cuts to public safety. As Richard talks about the budget, last year the county was faced with $29 million deficit. The sheriff was hit for $11 million. I don't know about probation or social services, but after we all suffered these losses of programs, and for the 3rd time, our raise, for those of you that don't know me, I was a deputy sheriff up till last week. And all these county agencies had to take a hit, but Richard was able to get $3 million for St. Rose Hospital. So when it comes to county priorities, I think public safety is number 1. If there's any place that needs to be cut, it should be juvenile services, because they belong at home with their parents and in school with their teachers. I've seen a lot of young kids. I did 2 years with juvenile justice as a deputy. The kids are our backbone. They belong in homes and in school. When they have to go to juvenile hall because they don't have a place to put them because we're short foster parents, that kind of breaks my heart, because I've spent a life working with the youth, coaching and mentoring, trying to keep them out of gangs and in school. So as far as that goes, no cuts to public safety. I want you to all feel that you can go home after work or after school safe. And I think bring the kids home.
Thank you. Okay, the next, we have several questions about health care. The next question, we'll let Mr. Valle go first on this one. Alameda County is ahead of most of the country in organizing health exchanges. How can we forge ahead in implementing the Affordable Care Act? And do you foresee universal health care for all Californians?
I wish, yeah, that would be wonderful. And the Affordable Care Act actually presents a great opportunity for all of Alameda County and the state of California. As some of you know, the state is already out there in front implementing the Affordable Care Act, and Alameda County is doing that. We have a great leader in Alex Briscoe, the head of our health services program, and he's been able to have dialogue with Children's Hospital, San Leandro Hospital, St. Rose Hospital. Those are safety net hospitals that serve the most underprivileged in our communities. And it's a real key in terms of the county's mission. The county's primary mission is to those people who are least able to take care of themselves. Those are the most vulnerable. I'm talking about disabled people, seniors, children. Those are the people that the county really focuses on when it comes to resources. St. Rose, as you all know, is in a fiscal crisis, but so is San Leandro Hospital. And Children's Hospital, thank goodness, to UCSF, may be able to survive as a result of UCSF's intervention. Alameda Hospital is also looking quite vulnerable. But this is a trend that's happening not just in California and Alameda County, but throughout the country. The Affordable Care Act will again present greater opportunity for those hospitals to flourish. And the reason that the $3 million was made available to St. Rose was to keep it afloat for the benefit of the poor.
Thank you. Mr. Green?
Some studies I've been reading about the Affordable Care Act are actually predicting that we're actually going to be getting a net employment rise out of this implementation, which I think certainly from the Bay Area and Alameda County and the state of California would all be very positive things to be happening. You know, from a healthcare standpoint in general, what can we be doing more of? I know that we at some point have to make a true mission statement, I think, here at the county level. What are we going to be doing with a St. Rose as an example, since it was brought up? I know that Washington decided they couldn't step forward, talking about Washington Hospital here, could not step forward and take care of St. Rose alone. That made sense. Kaiser chipping in millions of dollars on a loan. The county earlier in the year floating money in their direction. Richard just mentioned UCSF. I think as a county we're going to make at some point here take a stand in the sand. What are we going to do? Are we going to say that yes, we need to be subsidizing? I know that Measure A right now provides something like $2.5 million a year to the county hospitals, or actually to St. Rose. But we need to be making, I think, more in that direction. But to do that, again, you always have to come back to what sort of the previous question was, that you have to show fiscal restraint and fiscal responsibility across the board. Then perhaps we could be going forward, as we are right now in November, with, I know perhaps to the chagrin of some people, with a transportation ballot. We need to be going forward with something on a county level, like beyond Measure A. And do I think universal health care? Yes, that will happen sometime in my lifetime if I can make it to the average age of American male in 2012.
Thank you. Mr. Turnquist?
The solution to health care is self-insuring. Alameda County pays Kaiser equivalent to those that don't want Kaiser, roughly $1,000 per family. So if you figured 30,000 employees for Alameda County, that's over $3 million going to Kaiser. Why don't we put that money into a savings account, create our own health care, and you can go to any medical provider I use myself as an example. For 24 years with Alameda County, I went to the doctor 4 times. Kaiser made thousands of dollars off of me. So if you want health